You know, most Americans believe we've got the best healthcare system in the world, but the truth is, unless you've got money or health insurance, you don't get any healthcare. So we decided here on TV Nation to take a look at the countries just to the north and south of us and compare the three healthcare systems to see just what's going on. And remember, more than 30 million Americans get no healthcare coverage at all. Watch this.
The countries, the U.S., Canada, and Cuba. The healthcare systems, free enterprise, government paid, and socialist. The challenge, legs, ankles, and feet. Tonight, these teams of some of the best healthcare professionals in the world face off for another evening of grueling competition in the TV Nation Healthcare Olympics. In the U.S., watch the team in Florida face the obstacles of a private insurance-driven system in order to maintain America's position as a world leader in research and technology.
I think we do a great job in America. We're really at the cutting edge.
Then in Toronto, Ontario, will Canada continue to score big with the access and simplicity of universal coverage?
They can come without having to worry about paying for anything.
And in Havana, Cuba, can this third world republic continue to remain competitive with the medical powers of the industrialized world in the face of severe economic strain?
The system, a very good system.
Good evening, everybody. I'm Bob Costas. Another exciting day as three countries were poised for the global challenge of today's lower limb competition. Now, joining me in our TV Nation coverage is my longtime colleague, Ahmad Rashad.
Thanks a lot, Bob. Now, you know, anytime two very strong government-based systems and one solid market-based system lock horns, excitement is always guaranteed, and today was no exception.
I'll say. What criteria were the judges primarily looking at?
Well, the ER performances were evaluated on the ADCs of healthcare: access, delivery, and cost.
All right, so let's track the action as it began here in the U.S., where security was tight and the sideline gang got things started with a cheer.
USA is #1.
The venue was Broward General in Florida, where the patient entered without any assistance and took a seat, ready and waiting for the first step.
Bob, what's interesting here is that long waits are typically more characteristic of Canada, with rationing of services due to limited resources. But as you can see, the patient at Sunnybrook Health Science Center in Ontario practically sailed through the check-in process.
And down in Cuba at Calixto General, the patient, as you see, arrived in an ambulance right away, a sign of a higher degree of difficulty in his injury.
That's exactly right, Bob. Also, if we get an instant replay here, you see that the patient came to the emergency room with a temporary cast and a set of x-rays already.
Back in the U.S., the patient went through triage, a way of prioritizing treatment according to severity, whereas in Cuba, the patient was immediately surrounded by team activity. No triage necessary. After check-in, the patients in the bigger countries were exiled to a sort of waiting area limbo.
Not necessarily a bad place to be, Bob, because as you can see, some of the players even managed to provide care in the hallways.
Sure, but wasn't that ankle more vulnerable there than it would have been if he'd been waiting in a cubicle like the patient in the United States?
Vulnerable indeed, when an innocent bystander added insult to the injury.
I'm sorry.
Now, if we take another look, we see the unintentional punt right there.
Ooh.
Luckily, there was no additional damage done, but nevertheless, quite a tense moment there at Sunnybrook.
And it's a good thing he was headed for x-rays, just like his counterparts in Cuba and the U.S., where the x-ray machine signaled the end of the first half. And we neared the end of halftime with a fine view of the Cuban venue from the TV Nation blimp. Thanks for the shot, guys. Those fellas do work hard. Should be an interesting second half, Ahmad.
You bet, Bob.
Now back to the action. The radiologists and doctors took a closer look and found a hairline fracture in Canada, a bad sprain in the U.S., and a flat-out broken leg in Cuba.
We caught up with the team in Cuba after the bone-setting operation for a post-op locker room interview.
Como lo había dicho anteriormente, ¿no? Totalmente satisfecho.
I am totally satisfied with having succeeded once more in having fulfilled the task of resolving a problem with the human body.
In the final stretch, our clock showed that the industrialized nation patients had more wait time before their casts were put on, with total precast waiting time in Canada coming to 2 hours 15 minutes and 1 hour 15 in the United States. Meanwhile, Team Cuba made sure their young patient came out okay, keeping in mind that unlike the others, He did have a broken leg and therefore needed an operation to set the bone. But, as you can see, it was a big success for Calixto General.
The Canadian team relied heavily on the star performance of this doctor through the casting process, with the team members at the United States venue showing proficiency as well. Ultimately, all countries got their patients up and on their way.
Man, that was exhilarating action, almost like you're right there.
Tremendous footage.
Yeah, I definitely second that. Well, the scores came in, and as we anticipated, it all came down to the big C, cost. In Cuba,
The patient doesn't pay nothing.
in Canada,
$15 for the crutches that he just received. That's it.
and in the U.S.
The patient will be charged $80 for an emergency room service visit. Foot x-ray, $137. Ace bandage, $44. X-ray of the ankle, $118. $16.90. Dye used in the x-ray process. Adult crutches, $46. Total charges for the service, $450.70.
Unfortunately, it may take a while for the United States to make its way through the insurance obstacle course, and who knows what could happen with reform, but always a solid performer, they came in third. Cuba had some really great moments and wins points for such a comprehensive medical system, but until they find a way out of economic isolation, it's going to be hard to sustain the quality of their system. Cuba placed second.
But it was our neighbor to the north who stood strong with over 20 years of universal access. They take the lower limb gold in '94. Yes, Team Canada, seen here waving the flag of victory as another night in the TV Nation Healthcare Olympics comes to a close. Now, a disclaimer. This competition applied to lower limb injuries only. Who knows the outcome if we were talking gallbladders, tonsillectomies, or liposuction. Thanks for joining us. I'm Bob Costas.
And I'm Ahmad Rashad. Good night
and good health.